Hello, my name is Sara Heineman and I am a genetic counselor. Most of the patients that I see in clinic will either have a diagnosis of cancer and either a rare cancer or a pretty significant family history of cancer, or they may not have cancer but have that significant family history of cancer. And so their main question is, what are my risks of developing this or developing another type of cancer? One of the most helpful things patients can do when they're planning to come in and see us in the cancer center is really ask around your family for a little bit more of that cancer history. Find out what diagnoses people had, what age they were diagnosed with cancer, and write it down, because sometimes it can be lots of tiny details that can be really helpful in how we work about determining, might this cancer be something that just came about on its own kind of randomly, or might it be something that's more hereditary or inherited in nature. My biggest goal when a patient comes in to see me is really just to understand their story. I think part of being comfortable is knowing you're with people who care about you and where you're coming from, and really get a sense of how the information I can provide might be helpful for you as you move forward with making decisions about your own care. One of the biggest things I think really just brings that joy for me is when a patient really can feel empowered by the information that I provide, and they feel like this is information that I can share with my loved ones and with future generations so that they feel like they can take care of themselves to the best of their ability as well. I think coming to Holden Comprehensive Cancer, you'll find that this is a place where you really have so many specialists that really understand the nitty-gritty details of how these cancers work. Because of that, there are a lot of things like clinical trials that are available for patients to be enrolled in, and for some people that's something that's really exciting. When I came in to interview, everyone was just so warm and so welcoming, and you could really tell that they were here for one thing primarily, and that was to provide the best patient care that they could. And for me, that's exactly what I was looking for. The patient should be the forefront of all that we're doing. That's the reason we do what we do.